Okay.
Good morning, everyone. This is Deanna Diamore, Health Director for the City of Norwalk. It is 8:04. We will start the meeting. Present, we have Board Member Ken Lalim, Norman Weinberger, Terry Quell, Vincent Amaruccio, and Janet Karpiak. Those are 5 Board of Health members. And we have Megan Fogno and Teresa Argandesi from the Norwalk Health Department here as well. Good morning, everyone.
Good morning.
The first item on our agenda is approval of the December 22nd, 2020 meeting minutes. Do I have a motion?
I'll move the minutes.
Second.
Okay, second for Terry Quell moved, Norman second. Any discussion? All in favor, say aye.
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 Any opposed? Any abstentions? All right, all passed. Thank you, everyone. The next item on the agenda is public participation. Larry, do we have anybody from the public who would like to speak?
Yes, we do. And if anyone else would like to speak, please raise your hand electronically and I will unmute you. Please state your name and address for the record, please. We have Diane Laricella.
Good morning.
Good morning.
Good morning, all. First of all, thank you again for having a public participation portion of your meeting this morning. I'll be brief. The first thing is that I am looking forward to hear the 10 Norden Place report. I know that Ms. Diane Cece and others had requested that this was a very good time for the Public Health Department, the Board of Health to weigh in on an application where there would be additional air quality problems as well as safety issues, which is a health issue, getting run over by a truck, that sort of thing. So I'm looking forward to that. I hope that this report will state that the Board of Health, or I'm sorry, the Health Department and the Board of Health can weigh in and give their opinion about not whether the application is a thumbs up or thumbs down, but at the very least, you have an obligation based upon the charter to talk about times when health issues will negatively affect the people, we the people. So that's the first thing. I don't, of course, know what's going to happen. I look forward to your report, Deanna, and all. Number two, I'm here just to say once again that it's been a long haul, a long road for the people in Norwalk, as well as the staff and this board. I am very sensitive to that, empathetic to that. However, the messaging, especially where it comes to masks, is still inadequate, especially due to the fact that there are some variants that many of us see on television and read about. My New York Times subscription, I try to keep up with it. However, not all of the public has that ability or is confused by what they hear from different points. That is where the health department can and should be a place where the public can get information that is in layman's terms, but also is helpful. And I still feel, and I have poured over the COVID-19 button on our city website, the button on the homepage. I looked through, I will say that the graphics and some of the CDC materials on masks is better, but you have to dig for it. And I doubt very much that most people, other than myself and others that I've worked with on tough issues in this city, would do so. So I ask that this board, once again, considers requesting under a special request for money for a medical communications consultant to assist Deanna Diamore and Teresa Argandesi and Josh from the mayor's office, because they are still not properly and creatively looking at this issue of the masking. Now we're talking about double masking. Well, I think the public needs to know when that's a good idea, some of the precautions. And again, none of the three people I mentioned would I expect them to be mask experts. However, they are under obligation to find a mask expert to help them and the mayor adequately discuss the issue of masks. It has still not been done. And lastly, I just want to say that something so simple as just saying that exhalation valves on a mask for COVID are not a good idea, should not be worn indoors. That is a simple message where you explain what an exhalation valve is, and then you just say, don't wear them indoors. Save those masks for when we don't have COVID. That would help reduce the spread of this virus in our city of Norwalk. The minutes that I've looked over are inadequately producing my message of my concern. And I lastly just want to ask this board to take a look. I do not understand still your structure where you have your very busy health director run this meeting, take notes, take a roll call. I'm sure there are other staff helping take minutes. You should have a separate chairperson of your board of directors. And I will ask this happen through the ordinance committee of the Common Council, because we have to modernize and reform this board of health. The minutes, one would never know looking at the minutes that I have a proper concern about people being very, very exhausted about wearing masks and taking those other important precautions. There is still nothing about aerosols and how 6 feet is inadequate, and telling the public the truth about the aerosolized COVID. And so I ask again, and I will continue asking at this meeting and through other means, that we get real about COVID in creative ways, not just on the city website and in different languages. Please, I ask you. So I thank you and have a good day.
Thank you, Diane. Larry, is there anybody else who would like to speak?
Yes, we have Diane Cece. Diane, if you can unmute yourself.
Good morning, everyone. Can you hear
Good
me?
morning. Yep, good morning.
Thank you. I'll be brief. I think I need to hop in between here and my and work, which is important. But once again, I'll have to open by saying we just can't have too many Dianes in the city. So we'll get all the rest of the Dianes to join in here as well. Thank you so much. My name is Diane Cece. I'm hopping on here in my role as the president of the East Norwalk Neighborhood Association for your discussion on Norton. And I hope that I can, I know it'll be on YouTube so I can catch up later, but I hope that I can hear some of it as I'm toggling between here and work. I just wanted to preface by saying, I know I've had the conversation before with Ms. Diamore, is that I think the role of the Board of Health needs to be examined going forward in terms of identifying the full purview of what impacts health in the city of Norwalk. And the example I always give is that in looking at the health of the residents moves you outside of, say, doing a permit approval, say on a new restaurant, or dealing with something where there's an establishment where someone is choosing to use an establishment and you're concerned with health and safety at that point, or a salon, for example. In the case of Norton, where you may have a health department sign off for the parcel and the structure itself, this is a great example of where residents think that our Board of Health and our health department can go further than that and say, what is the peripheral impact on the health of the city? And in this case, as you already know, it's a tremendous impact on not just quality of life from noise and light pollution, but from air pollution as well. Several hundred diesel trucks a day, There's no access to that site except through residential neighborhoods, which we'll hear from Mr. Amoruccio in a moment. And I think those things need to be taken into account. I'm glad that that you're able to revisit Norton, because it would be great if the health department could speak on behalf of the residents with concern over if this thing gets approved. But I also think it's great for the future to take a look at expanding the role of how you look at commercial and industrial permitting in the city and what your role is. Thank you very much. I appreciate your time. I hope to stay on to listen. If there are questions and I'm available, if just holler out and I'll hope to answer any questions, but I think you'll get a thorough review this morning. Thank you.
Thank you, Diane.
Okay,
Blair,
there's
any
no
other-
one else with their hand raised.
All right, thank you. So I just want to give a quick director's report before we get into the next discussion item. Just wanted to let you all know we did hire a new part-time medical technician to help with clinical services. So she started a couple of weeks ago. It's going really well. So she's providing additional support in the lab for our clinical services, as well as just providing assistance during, you know, our sexual health clinic and other clinical services. So that's been a big help. And we also are posting 2 temporary grant-funded contact tracing positions to get us through the end of the year to help with contact tracing, which would be a big help. We do have amazing community health workers that we've had a partnership with the Family and Children's Agency. They're funded through the Connected Health Foundation. And so we continue to work with them to support contact tracing and our staff as well. As I'm sure you're all aware, a lot of the resources of staff time has been put into immunizations now. So we're looking forward to being able to fill those positions right now, utilizing funding from the state. So that's my quick director's report. Any questions related to that? All right, our next item on the agenda is the 10 Norton Place application. Vince, are you able to, do you want to pull up your slides? Vince, you're on mute. I don't know if you realize that. I don't know if we lost him for a little bit. Would you like me to give my COVID updates first and then get back to the other agenda item for when he's able to join us? Or should we?
That'd be great.
Sure, that sounds great.
Okay. All right, so we're moving to item 5 on the agenda and we will go back to item 4 as soon as he's able to connect back in. Oh, wait, hold, he's connecting. All right, I'll just start and then we can, as soon as he's done, we'll move on. So in terms of COVID-19, we have some information. We are at over 8,000 cases in the city of Norwalk. We're still in the middle of the second wave. If you remember, the first wave was March and then it went through like end of May, early June. But this wave, it really started, for the state, it started back in August, but in Norwalk, I'd say it really started back in September. So it's definitely been a longer time of increasing cases. Looking at the case counts, we had our highest case count, right after, the holidays, the December holidays and the new year. And so we're keeping track of the cases, but we're seeing sort of a leveling off of hospitalizations, but we're also paying really close attention to the different variants and strains that have been reported. The governor reported yesterday additional strains of what's commonly known as the UK variant. In Connecticut so far hasn't been in Fairfield County, but obviously the state is keeping close watch of that. Our positivity rate has been around 10%. It was around like 9% in November, December, and it's around 10%. I'm going to run the numbers again today, so we'll have to give an update in the mayor's daily briefing on where we are within the past 2 weeks. And then I just wanted to talk briefly about where we are with immunizations. We vaccinated more than 800 individuals so far. This week, we are beginning the second dose clinics for those who had been vaccinated for the first dose at the end of December. And so we are also going to be holding several first dose clinics for eligible individuals at the same time. So this is our first week of doing second dose while we're also doing first dose clinics. We were lucky and fortunate to get a large allocation this week from the state. And so we're working on, getting people into those clinics. There was some confusion throughout the state about phase 1B and when it would start and who would be eligible first. I'm sure you all are aware that there are several different groups within 1B, but the priority right now for the state is to vaccinate those who are age 75 or older. And so the other groups that are in phase 1B are those ages 65 to 74, the frontline essential workers, and those younger than 65 with an underlying condition. So they're going to be eligible later on in this phase, but we're still waiting additional guidance on the timeline and the process for enrolling those individuals to be vaccinated. We're right now using the VAM system that the state is utilizing, but we're also working on additional options for us. It's something we had asked right at the beginning of vaccination if we can use our own electronic medical record system or health record system, because we thought it would be easier both on our end, but then also, of course, on the individuals who are getting vaccinated. So right now we're working on with the state to transition to use our own electronic health record system. And then also utilizing that for scheduling individuals. And so our hope is to make it easier for seniors to be scheduled, to get access to vaccination appointments through us, because we know that the VAM system can be challenging for people to navigate. The city created a page on the city's homepage, norwalkct.org/vaccine, where residents can go to get information about who's eligible and how they can enroll. There's different options right now for scheduling vaccines. I mentioned VAM, so there's a lot of the clinics and providers that are utilizing that system. Some healthcare providers are scheduling directly, and then there's also the Connecticut Vaccine Appointment Assistant line. So again, we're recognizing that these options can be, challenges for our seniors, for those 75 and older, and we're working with our community partners and our volunteers to create another scheduling option and to make it easier for them. And so we hope to have more information on that soon. We are, and I just wanted to conclude some of our thoughts that, while there's been challenges, of course, there's been a lot of successes, and I can't thank the staff and the volunteers enough for all that they've been doing. Our volunteers are incredible, our emergency response team. Some of them are taking time out of their own work days to volunteer just to be there at these clinics to support them because they recognize how important it is. So again, that emergency response team is incredible, and Donna and Glenn are doing such a great job, pulling them all together, and the staff too. They're working really long hours pulling this all together. So we're looking forward to continuing to vaccinate and to continue to improve our processes and making it easier for the public to access the vaccine. So that's the COVID update. Does anybody have any questions, any comments related to that?
This is Ken. How have you handled Spanish-speaking citizens?
Yeah, so we are working on, we have the process we're using moving forward is we're going to be able to utilize our own volunteers and staff for scheduling. We have bilingual staff, we have bilingual volunteers. So moving forward, we're going to be utilizing our own systems so that, right now VAMS is only offered in English. So we're looking to create a local option for people that don't speak English to make it easier. That if English isn't their first language, but then also the Connecticut Vaccine Assistant line, like 211, is also looking to provide options for those that are speaking other languages. Teresa, do you have anything to add to that?
No, I don't have anything to add except that we recognized early on that that was going to be a challenge with the VAM system, and so we're trying to supplement locally wherever we can.
Yeah, it's a real issue statewide from a health equity point of view. It's just continuing to push that divide even further And we're having a difficult time with trust issues and all the rest for a portion of the population in the Black and brown community that really is disadvantaged by this. And as the gap gets bigger and bigger, it gets worse and worse. And the fact that it's not offered in any other language but English that's a tragedy.
And I just wanted to add, once we are able to use our own EHR, we can have a lot of those things within our EHR translated into Spanish because we're the ones, managing the capabilities. So we're hopeful that we'll be able to use our own system soon, and we'll be able to provide that in other languages.
That'd be great.
I have a question as well. I'm wondering if there's any type of plan or resources for homebound seniors. I have a friend whose mother is in a wheelchair and none of the vans are running. And she's wondering, like, what options does she have to get her mother somewhere to be vaccinated?
That's another thing that we've been talking about with our partners as well. Like, we've been talking with the hospital, with EMS, with our different community agencies on creating those opportunities with the community health centers that have mobile medical units. How can we utilize those resources to reach people? We don't have a system set up in place now, but it's something we want to move towards.
Yeah. Okay.
I know the state is working with VAO, who's at least on the Medicaid side of the house. They're the non-emergent Medicaid transportation provider. And so they have some programs that they're trying to work on. They're doing a pilot right now up in Hartford to actually see about having the transportation company be the vehicle that gets the patient into, at least when you're doing a mass vaccination site, you can do a drive up. So there's a couple of those pilots running out there to see how that would work. So hopefully there's some help along those lines in the very near future.
Great. Thank you.
Well, thank you, everyone. I know, Vince, are you able to connect now? Are you on?
Yep, I'm back. Can you hear me?
Yes, we can. Are you able to pull up your slides?
I think so. I switched computers because my one computer is giving me a very hard time, and I'm traditional now. I'm talking through my phone instead of my computer. Hold on one second. So can you just confirm that you can see my screen?
Yes, we can.
All right.
Vince, I'm going to pass it on to you to present. Thank you.
Yep. All right. So you're all set. You can see my screen?
Yes.
All right. All right. So I pulled together a few quick slides to review the safety and environmental concerns for the special permit zoning application that Diane and Cece had mentioned during the public participation. It's around 10 Northern Place. All right. So just a really quick overview. I'm not sure if anyone else on the board has been following this. So what it is, it's a special permit zoning application to renovate the 330,000 square foot facility at Northern Place into a 19-dock distribution center. The application has been going on for some time now, and I believe the next and final public hearing is occurring February 8th. So this meeting today is relatively timely. The developers who, we know that the tenants are unknown, but we know who the developers are. They wanted to create a regional hub for warehouse to business deliveries. So the proposed application is going to result in at least 198 truck trips per day, including tractor trailers. The truck routes are Winfield, Strawberry Hill, Triangle Street, Beacon, East Avenue, Fitch, and then Northern Place. And I should have prefaced my slide by saying most, if not all, of the information that I'm pulling together for the slides today, they come from the City of Norwalk website. So this is all public information from the applicants, either the application, interventions, or their responses to certain documents. So continuing, I mean, this is just a screenshot of Google of where 10 Northern Place is. It's off of Strawberry Hill. And the reason why I put this into the slide is really just to kind of emphasize that it is a very residential area. Every method of getting to this facility, you need to pass by residential homes and apartment complexes. And even in the Northern Place site, there is, I believe, there's an apartment complex there as well. So to try to highlight the health information, there's a verified notice of intervention that actually has a lot of the health concerns already highlighted. So I didn't have to really dig too far for this information. The notice of intervention is coming from the Sasquatch Hills Neighborhood Association. It comprises citizens from the city of Norwalk residing in the surrounding areas: Pequot Drive, Heron Road, Heron Court, Willow Road, Little Way, Winfield Street, etc. I will, for full disclosure, I am a resident on one of these streets. However, that's not the reason why I'm pursuing this or pursuing voting on action. I do personally feel that if this particular application is approved, it's going to set the precedence for other applications either in the same area of Northern Place, because the site is relatively large, and possibly other sites within Norwalk for the same intentions. The basis of the intervention from Sasquatch Hills and from many others is around Section 22A-19 of the Connecticut General Statutes, which essentially says that anyone can intervene on an application if they feel that the effect is unreasonably polluting, impairing, or destroying public trust in the air, water, or other natural resources, which I and many of the people in the area do believe it is. They've highlighted a lot of the health concerns in terms of the particular pollutants that they're going to be included. And this comes directly from the application. So the application lists off that there's going to be additional pollutants such as ozone, carbon monoxide, carbon dioxide, nitrogen oxide, reactive organic gases, particulate matter, sulfur dioxide, and lead. And for some of them, they list how many pounds per day will be emitted. And what I did additional to that was I looked at it from a yearly perspective. So even if you look at just carbon dioxide, they are saying that on a daily basis with the 198 trucks, it's going to release approximately 1,500 pounds, which turns out to be roughly 600,000 pounds per year. And the traffic that is also going to be included will produce additional diesel particulate matter emissions that are found in the truck engine exhaust and consist of a mixture of gases and fine particles such as smoke or soot. So also included in the intervention from Sasquatch Hills Association is some really simple statements about what it conflicts with in terms of the city of Norwalk and some of the state governance. So this application is going to conflict with or obstruct air quality plans with Norwalk. We're promoting a healthier Norwalk. This goes against that. It violates air quality standards. I've highlighted the number 3, which is that it results in a net increase of any criteria for air pollutant for Connecticut is non-attainment under an applicable federal or state ambient air quality standard. And the reason why I highlight that is you'll see in the last slide, one of the responses to the environmental impact statement is that they cite just being by 95 alone is already emitting all of this. So, additional particulates at a small increase aren't that harmful. And here I'm just focusing on that any net increase in any of them really is harmful. It exposes all the residents to excessive, substantial, and harmful pollutants. It creates substantial and objectionable odors, or it's increasing them. It results in increase in excessive emission and results in the potential to expose persons to substantial and unhealth levels of toxic air contaminants. So there is an environmental impact statement. So the OSTA administration requested an environmental impact statement from the applicants. One of the things that caught my eye when I read that response was that they stated early on that the data for truck trips for research and development use is not available within industry standards, and that they assumed that the truck traffic in the scenario would be the median value. And in their conclusions, they basically said that anticipated emissions that will be generated as a result would be similar to those of any applicant permitted for the zoned area, and that the facility is immediately adjacent to I-95, which already subjects the area to health concerns from emissions. So to further enhance some of the health effects from diesel exhaust, there's two articles in here. I'm not going to read them verbatim. One is from the American Lung Association in California. They've highlighted that exposure to diesel exhaust can have immediate health effects. Diesel engines are a major source of fine particle pollution, and numerous studies have linked elevated particle levels in the air to increased hospital admissions, emergency room visits, asthma attacks, and premature deaths among those suffering from respiratory problems. And then likewise, another one it's an article that was published in Science Daily. It basically states about 2 years ago that a new study reveals that large diesel trucks to be the greatest contributor to harmful black carbon emissions close to major roadways, indicating that vehicle types matter more than traffic volume near road and for air pollution. So based on all of that, I wanted to highlight that this particular, my slides are kind of also ignoring traffic and other health concerns, but I felt that based on this, the Board of Health should at least consider taking action. What I'd like to take a vote on is two things. For us to vote on submitting written testimony to the Zoning Commission on behalf of the board for the public hearing coming up to ask the Zoning Commission to deny the application for Northern Place, acknowledging that it needs to be sent in advance of the February 8th final hearing, and then also to vote on presenting at the public hearing a statement of opposition from the Board of Health. If we do vote on either one of those, I'll volunteer myself to draft a letter on our behalf and also to speak at the hearing. And then additionally, not really for a vote, but I think it's important for us to revisit policies and procedures for approving commercial development permits in residential areas in the city of Norwalk. Even if this application is turned down, we can see just by traveling through Norwalk that they are moving forward with development opportunities, and this will come up just in a different area. So that concludes my presentation, and I guess we can have a discussion.
Well, I guess I'll start. This is Terry. Thank you, Vince, for bringing this to our attention. I too live in the neighborhood, and I just cannot understand how they even considered this location, not only with the air pollution and all that piece of it, but there are 3 schools in the area, an elementary, a middle, and a high school. And I've looked at the truck routes as well, and they do pass all 3 of those schools. Plus, there are several playgrounds in the area and a whole bunch of ball fields, because there's more than one field on each of those different school properties, plus a couple of playgrounds. I do walk in that area. I walk in the Winfield and Strawberry Hill. I'm off of Strawberry Hill. And the number of cars that are already on those roads with kids walking, and there are kids walking as early as, school starts at 7 for the high school. So there are kids out walking at 6:45 in the morning, and they're still walking. I think the elementary school starts around 9 or so. And then in the afternoon, there are high school kids are getting out around 12:30, 1 o'clock if they have open end or whatever. And there are kids still out at 3:30 in the afternoon coming home from the elementary schools. So people are already speeding. Those are 2-lane roads. They're not highways like Route 1. They're 2-lane roads, and some of them are even smaller. In fact, many of them don't even have good sidewalks or good bike lanes. Some of them are too narrow, some of those roads, to have bike lanes. So I just don't understand why they're considering having this much truck traffic on there on top of all the health concerns. So I totally agree that we should, look at this, because I don't think it's a proper location.
I agree, and for the same reasons that you stated, Terry. I don't know the extent in terms of who is supporting this from Westport, but I am aware that various organizations in Westport are also in support of us in Norwalk moving forward to ask the Zoning Commission to deny it, because exit 17 would require trucks coming off in Westport to travel through parts of Westport.
This is Norman. I want to thank you too, Vince, for bringing this up. I've been following this and been very concerned about it. As a pediatrician, we're, as you stated in your slide, very aware that this particular matter, particularly in kids with their developing lungs, causes a huge issue. And there's innumerable studies that show that in areas of high output, like along highways or in industrial areas, the kids living in there have a much higher incidence of respiratory disease than kids in the countryside. So I'm in full opposition to this.
Thanks, Norman.
And she says, Ken, you had mentioned that there's the potential for other properties that are being developed. Are there others that are close to having that happen, that this will affect more than just the Norton space?
So I don't know 100% the answer. I can come back to answer that. What I can say is that I've seen, so in preparing the slides and reviewing the materials on the City of Norwalk website, I believe that I've seen other applicants for the area. I'm not sure if it was an alternative to the specific site or in addition to. So I have seen at least one other application personally.
But certainly there are other areas in Norwalk that have some of the same issues. Some of the areas in South Norwalk where they're having these construction sites and disposal sites have those issues. And the folks in those areas have been talking about it.
Yes, I agree.
Yeah, I'm just thinking, I know trying to link things is difficult. Everybody, the developers obviously want to do them all as one-offs. I was just wondering if there's a way to aggregate some of that clout.
I agree. So my opinion is two things. Is that A, I think that in us voting to send a message to the zoning board that we oppose this, I think also starts the precedent, so that if this is turned down and others pop up and we vote against those as well, they won't be surprised by it. And then again, I think that we need to just come back and start revisiting what are the steps that the health department plays in these commercial development permits, specifically those that are in residential areas. I came about this kind of reactively because I live in the area. So that scares me into thinking that there are other applications that are going on in the city that we don't even know about.
Vince, just to add to that point, in the POCD, there is a strategy and action step in there. I'm just reading it it's consider creating an advisory health impact statement for use when adopting citywide district and system plans and in the permitting process for projects meeting a defined project size. So this is something that, it was included in the most recent POCD. It's something for potential for the health department in the future, for the Board of Health in the future, thinking exactly about that. How do we frame that out? What does that look like? What kind of staffing commitment does that take? So that is certainly something that I've been thinking about, and I know others, across the city have been thinking about as well. So just wanted to mention that about the POCD. So in the future, is that the direction we want to be moving in, that health impact statement for certain projects?
I certainly think that's a role of the health department.
Well, I would think there would be noise issues as well. I'm sure there will be. And I know that comes to the Board of Health as well. And someone's going to have to address that if they're loading and unloading, multiple trucks late in the evening or early in the morning. I would think it would make some noise.
just the trucks rumbling through the neighborhood.
Mhm.
Yep. There's also been mention, but I don't know that I've seen any sourced evidence to support it. That's why I didn't bring it up. But there's been mention of light pollution as well.
Mm.
Any other comments or thoughts or questions? I don't know if Vince, you want to make a motion?
Yeah, so I'd like to make a motion to vote on the two items: a unified letter to the zoning commission and an appearance at the hearing.
Do we have the second? Norman seconds it. Any further discussion on that, on those two items?
So Deanna, I guess the question to you is, since it's been approved, I'll draft a letter and have it reviewed by you and the rest of the board before sending it out.
Okay, great. We have to vote first, though.
Oh, I'm sorry.
No, it's okay. So yeah, if vote approved, yep, that sounds like a good plan. All in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, the motion passed.
Thank you. There you go.
All right, thank you, Vince.
Thank you, Vince.
Thanks for all the hard work.
Yes. And Vince, will you send us the link for the Zoom meeting, the public hearing meeting?
Yes, I will
Great.
coordinate all that information, including a draft letter.
Awesome. Thank you for doing that.
Thank you for your support.
And Dan, I think that somewhere in the minutes, it should reflect that the board also is looking at the future. So we can look at, what kind of authority might be vested. I know right now it's not an authority position that we can take. It's more of a recommendation, but how do we advance this so that as future situations come up, because they will, if allowed, that there's a mechanism to cut through the red tape, if nothing else.
All right, thank you, Ken. All right. So our last item on the agenda is a reaccreditation update. We did submit another request to extend reaccreditation again, just to give us more time to be able to respond to the documents. We've been working nonstop with vaccination. I took a screenshot of us one night at like 7 o'clock, a bunch of us on a Zoom talking about planning a future clinic. So I mean, it's been a lot, obviously, but it's been challenging to find time to focus on some of the responses for reaccreditation. So I just wanted to let you all know that. Megan, do you have anything to update related to reaccreditation?
No, just that the extension was put in and we're awaiting the response. They told us we could have up to a year, so we asked for less than that, but they said up to a year.
Thank you, Megan. Any questions? Anything related to reaccreditation?
It's a lot of work, I know. I'm writing a report myself for a different organization, so.
All right, well, thank you all. I hope you have a great day. We'll
Great,
adjourn
thank
at
you.
8:47.
Bye,
Bye,
everybody.
everyone.
Thank you.
Thanks, Vince.